Latest publications from Cancer Communications. Non-recovery of renal function was correlated with increased mortality in the cancer cohort with septic shock. By authors Joon-Sung Kim and Yeon-Jung Kim, and corresponding author Won-Young Kim. Introduction. As the overall survival rate of cancer patients has been increasing, an increasing number of patients are experiencing septic shock, and the corresponding mortality rate is becoming unacceptably high. Among cases of organ failure caused by septic shock, the development of acute kidney injury is known to be common and correlate with poor outcomes. Moreover, a large Danish cohort study revealed that critically ill patients with cancer had a greater risk of acute kidney injury and requirement of renal replacement therapy compared to patients without cancer. Although the association between septic acute kidney injury and mortality has been widely investigated, knowledge about whether patients with recovered renal function have increased long-term risk of end-stage renal disease compared with patients who have not recovered renal function had been scarce, especially in the cancer population. Few studies have tried to reveal the clinical impact of acute kidney injury in patients with malignancy, and they included a relatively small sample size, or included only certain types of conditions, such as hematologic malignancy. In this study, the authors tried to determine the relationship between renal function recovery and long-term dialysis dependency among patients with cancer. Main findings. The authors found that non-recovery of renal function was correlated with increased mortality in the cancer cohort with septic shock. Even after recovery from acute kidney injury and successful weaning of dialysis at discharge, 1/4 of the patients needed renal replacement therapy within 1 year. One previous report announced that 82% of critically ill cancer patients with acute kidney injury had their renal function recovered, and only 6% of patients required long-term renal replacement therapy. Another study reported chronic renal replacement therapy dependence in 12.9% of patients with hematologic malignancies. The different occurrences and outcomes were largely due to the differences in the study population and the proportion of the disease severity. Conclusions. To our best knowledge, this is the largest study regarding acute kidney injury on long-term clinical impact in pooled cancer patients using a nationwide database with high coverage of the Korean population, that is approximately 97%. These findings could help to give a more comprehensive knowledge of long-term outcomes of septic acute kidney injury in cancer patients, suggesting that physicians should focus on the recovery of renal function during admission, and patients should be followed up carefully even after recovery from acute kidney injury. Thank you for watching. For more details and free full text of this work, please view the links in the descriptions below.